Thank you for joining us. It's an honor to welcome you today to this third in a series of discussions the JCRC has hosted to help understand the issues surrounding abortion, reproductive health, and freedom, and not only freedom to control one's own body, but also freedom to follow the dictates of one's own religious practices in doing so. The JCRC has a long history of advocacy in this area, and that advocacy now continues with a renewed urgency. Today, we're privileged to have with us four remarkable speakers on the front lines of these issues in our region. Before I get to the introductions, I want to share a few housekeeping items. First, please note that this webinar is being recorded, and we will make it available to you and to those who couldn't join us today in the days to come. We have turned on closed captioning. If you don't see the live transcription and would like to, there should be a closed captioning or live transcription button at the bottom of your screen. Finally, we will be taking questions after each speaker has had an opportunity to share the state of the law, legislation, and access in their jurisdiction. Please type any questions that you have into the chat function of the Zoom screen, and we will get to as many of them as we can. Now it's my pleasure to introduce our panelists. First, we will hear from Virginia Delegate Eileen Filler-Corn, the 56th Speaker of the Virginia House of Delegates and the first woman and first Jewish person to fill that role. She represents Virginia's 41st district, which includes parts of Fairfax, Fairfax Station, and West Springfield. A true problem solver, she has overseen results that have made Virginia safer and stronger, and has championed legislation that makes Virginia's progress more accessible to all. We also will hear from Maryland Delegate Ariana Kelly, a Deputy Majority Whip. Delegate Kelly represents the 16th district, which includes Bethesda, Chevy Chase, and Potomac. She serves on the legislature's Health and Government Operations Committee and is president of the Women Legislators of Maryland, the caucus of 60 diverse women, state senators, and delegates serving in Maryland's General Assembly. Delegate Kelly has sponsored and championed many pieces of legislation benefiting Maryland's parents and families. Of particular note today is Maryland's Contraceptive Equity Act. Next, we will hear from DC Councilmember Brianne Nadeau. Councilmember Nadeau represents Ward 1, where she engages directly with residents and businesses through civic organizations, volunteer opportunities in neighborhoods and schools, and through regular dialogue as part of her Brianne on Your Block office hours in the community. She serves on the Council's Committee on Health and Human Services, among several others, and is a champion of many issues at the heart of JCRC's work. Finally, we will hear from Allison Tombros Korman, Director of Operations and Strategy for the DC Abortion Fund, which helps those who need help cover the costs associated with getting an abortion in this region. DC Abortion Fund has been around for 27 years. Ms. Korman has been working in public health and nonprofit management for almost as long, including her work leading a national initiative to end campus sexual violence. Welcome to all of you, and I'll now turn the camera to Delegate Eileen Filler-Corn.
Thank you so much, Vicki, for that introduction. And thank you to JCRC Greater Washington for hosting this discussion. It's of critical importance, and I appreciate your leadership here. Also wanted to thank Ron Halper and Gila Franklin Siegel for joining me recently. I think it was just a couple weeks ago when I did a press event on Zoom focused on religious liberty as it relates to the aspect of abortion rights and public discourse. And so there's been a lot of discussion of this as of late, and more additional opportunities for us to connect and for us to discuss, I think, is critical at this time. So you asked specifically to talk about the current state of law in the Commonwealth of Virginia. I think it's important to begin by saying that access to safe legal abortion is still legal in the Commonwealth of Virginia today, thanks to Democratic leadership. I remember back in 2017, just 5 years ago, I was the patron of a bill. It was the Birth Control Access bill, which mandated that pharmacists could provide women a full year of supply of birth control pills if prescribed and permitted by a doctor. At the time, it was literally the first pro-reproductive health care bill to pass in the Commonwealth of Virginia's legislature in 10 years, just to let you know how far we've come and think back that far. It was literally just a couple sessions later that we were able to work with our colleagues in the Senate and the governor to make generational progress. And when I think about how far we've come, it's actually quite remarkable. Back in 2020, we took the majority, Democrats took the majority, and we had an opportunity to end Republican barriers to reproductive health care, which included a number of bills that had passed, repealing the mandatory ultrasound law, repealing the 24-hour waiting period prior to an abortion. We were able to repeal the targeted restrictions on abortion providers, which we know as TRAP laws, which basically were designed to close women's health centers. So due to our progress, abortion now is safe and legal in Virginia. But I can assure you that we are literally just one state Senate seat away from becoming the next state which could criminalize abortion. And we saw what has happened in other states. We saw what happened in Texas, where abortion has been criminalized and women are literally treated like second-class citizens, unable to make their own choices about their own health care and their own bodies. And I think it's important, obviously, that we also focus on, individual autonomy for women. And of course, a conversation and a discourse about the issue of religious liberty for Jewish Virginians is incredibly important. And that's what actually precipitated my desire and inclination to set up a Zoom press event just, a couple weeks ago. Why? Because our Governor Youngkin, came out and was very clear with what his plans were moving forward. When you look at where Virginia is, and also just like on the map, it's a safe haven for women in Kentucky and honestly throughout the South for any women who need safe legal access to abortion. Governor Youngkin has made it perfectly clear as of late that he's on the offense here, and what's transpired in the court has opened him up to do exactly that which he is planning on doing. He reaffirmed what we already knew. He is 100% opposed to abortion access, and he's already asked several Republican lawmakers to craft legislation. And he actually said that setting the cutoff for 20 weeks might be necessary to attract more consensus in a divided Capitol. He supports listening to his statements and his commitment and dedication to ensure that women do not have the right to choose and do not have access to legal, safe abortion is definitely his focus moving forward. He mentioned several times publicly that he is working on, with other members of the legislature on a draconian 15-week abortion ban for the next legislative session. And, he's indicated as well, I think the quote was literally that he believes that life begins at conception and that he would, quote unquote, gleefully sign any bill limiting abortion that came to his desk. So that's kind of, where we are and what we're up against. We have lost control of the House right now. We're 3 seats away in the House of Delegates. And we are 21-19 in the state Senate. And that is why I said at the beginning, we're literally just 1 seat away from that making a difference in the Senate. If we expand our Senate majority and flip just 3 seats in the House of Delegates, these type of bills will never even leave committee. That's the reality. During this past session, 2022, members of the other side of the aisle tried to pass bills that turned Virginia back, including a 20-week abortion bill limiting a person's access to get the necessary health services that they need. And, we in the House Democrats in the House of Delegates blocked these proposals thanks only due to the slim majority in the Senate. So we know now that where our governor is, and we know that the progress that we have made is in danger. And obviously we're standing firm and we're out here talking about just that because we will not go back. So, as a result of what happened in Dobbs, as I said, abortions right now in Virginia are still legal. It's not equally accessible, though, to all people who need it, obviously, due to inequities between high income and low income persons, privately insured versus public employees, geographically distance for travel for abortion care, and so many other factors, which include childcare and ability to miss work. I know often people ask about the code. Virginia's laws regulating abortion are in its criminal code, and abortion is referenced in the additional Code of Virginia sections and as well in the budget. But the Virginia Constitution does not contain affirmative protection to the right of an abortion in our statutes or in the Virginia Constitution. We can discuss maybe later. I know there's several other speakers, but I know it often comes up, the issue of codifying Roe v. Wade. In order to codify Roe v. Wade in the Virginia Constitution, it would actually require a two-step process in the legislature. Amendments to the Constitution first require passing each chamber, and then it needs to include a second reference to place the change on the ballot to all the Virginia voters. And, in the Virginia House, Democrats actually tried to waive the rules to introduce a bill during the last special session. And that was actually, that proposal was rejected by the House GOP. Despite the fact that, as we all know, a broad majority of Virginians support a woman's right to make decisions over her own body. I actually also had an opportunity to, through my PAC, to commission a poll, and the PPP poll showed that Virginians oppose overturning Roe v. Wade at a rate of nearly 2-1. And I think it was a Roanoke College poll also found that overwhelmingly 88% of Virginians support access to abortion, at least in some cases. So there's a lot, a lot for us to be focused on. I think during my press Zoom with JCRC and with some of the rabbis, we really brought up the issue of religious, not just religious freedom, and bringing up that specifically Governor Youngkin's focus and commitment to introduce the bill that he stated he's going to introduce, and his working with other legislators to also introduce similar legislation would be in direct conflict with Jewish religion and Jewish law. And so I think that was a unique perspective, honestly, that had not really been shared. I understand now, and we see that there's a lot more conversation about that. And I think that's important that we actually discuss that and talk about that more openly. And that's why I really appreciate and value the opportunity for this conversation. I think, and we'll probably get to this later, I think elevating these issues, talking about women and abortion and women's reproductive health care, bodily autonomy is critical, but so is the issue of religious liberty. And religious liberty obviously is at stake here as we face really unprecedented attacks from a vocal and powerful minority of Virginia politicians. Also in the Commonwealth, when I think about our governor, who is a person of faith and talks about his faith often, his actions are in direct conflict with many other Virginians and our faith. And you're talking about multiple religions and faiths here as well. So I think the only way to really ensure that these basic liberties remain intact in the Commonwealth is to elect pro-choice candidates in the next federal and the state elections, to ensure that we can expand our majority in the Senate and also flip the House. And I think that's probably enough for first. I'm sure there'll be many questions, but I just really wanted to thank JCRC. Thank you, Vicki, for the invitation. Thank you for putting together this panel. And I'm looking forward to hearing from the other panelists and then getting to your questions.
Great, thank you. I'm going to introduce Delegate Kelly now.
Great. Hi, thank you so much. Thank you for the wonderful introduction. This has been really actually interesting to listen to Eileen's story of what's happening in Virginia. I'm in Maryland. So for those of you who don't know me, Delegate Ariana Kelly. I represent Bethesda, part of Potomac, North Bethesda, part of Chevy Chase in Montgomery County. And I have served on the healthcare committee in the Maryland General Assembly for the last 12 years. I'm the vice chair of the healthcare committee, and I have focused a lot of my work on women's reproductive health care. just by way of background, because my name is Ariana Kelly, I'm Irish. I just got back from a trip to Ireland. Ireland is a overwhelmingly Catholic country, but they actually had a national referendum 4 years ago to ensure that abortion was legal in Ireland. So I just came back from Ireland, and they all think we have lost our marbles here in the US. I am Irish, but I'm also Jewish. I converted 25 years ago. So most people don't understand the Kelly and the Jewish reference. So that's the story there. Let me give you a little bit of sense of history of abortion politics in Maryland so that you can understand why we're at where we're at today. So 30 years ago, we did what we just heard, was a possibility in Virginia. We codified the protections of Roe versus Wade. We did that through a two-step process. We had a piece of legislation that then was sent to referendum for the voters. It was a grueling process in Maryland. This was in the 90s, 30 years ago, actually. And it resulted in an 8-day filibuster in our Senate. It was the kind of legislative initiative that people lost their careers over, other folks built their careers over. It left a lot of scars in Maryland politics. But when it went to referendum, more than 60% of the voters supported the codification of Roe versus Wade. And we really never looked back. For 30 years in Maryland politics, we did not pass a single piece of legislation related to abortion. We did that, we set it aside, and you would have heard over and over again, abortion is settled law in the state of Maryland. That served really to benefit anti-choice elected officials who wanted to keep getting elected. But what it ended up doing was, not only did we not pass any of those bad bills, those trap laws that we heard about that have been in Virginia over a 30-year period, we didn't bring any of them to the floor for a vote. We also didn't pass any legislation to modernize how abortion care is delivered in Maryland over a 30-year period. We were basically Switzerland of abortion. And in fact, last night we just had our primary elections, and the Republican nominee for governor actually introduced more anti-choice bills in the history of time than we'd ever saw from anyone else. And I'm mentioning this only because none of those bills ever came to a vote in the state of Maryland. But you'll see that we had dozens and dozens introduced, and we just didn't bring them up. And some of them really had some concerning implications for religious liberty. One of those pieces of legislation required that a religious funeral be prepared for any fetus lost, whether it was due to abortion or miscarriage. You would be required to have a religious funeral. Don't get me started on how concerning that was to me. But that being said, over 30 years in healthcare policy, if you think about not moving forward with legislation, you think about what abortion access really missed in the state of Maryland, right? Over that 30-year period, we saw the introduction of the Affordable Care Act, which meant that a lot more people had insurance coverage. Medicaid was significantly expanded. People got these essential health benefits with no copay and no cost sharing, but abortion wasn't part of that. We really learned to look at health equity and health disparities differently over the last 30 years and recognize that different populations have different challenges and need different supports in terms of accessing healthcare. Abortion policy in Maryland did nothing to address that. Advanced practice clinicians, nurse practitioners, physician assistants, nurse midwives became increasingly responsible for primary care and reproductive health care in the state of Maryland, but abortion policy wasn't reflecting that. We had a law on the books in Maryland that said, it was from 30 years ago, it said you have to be a physician, a doctor, to provide abortion care. Really, really outdated law, but because we would not touch abortion laws, we could not change it for 30 years. Again, medication abortion, more than half of abortions are provided through medication now. 30 years ago, when we fixed our law, we didn't know that. That wasn't even a thing. So what happened, fast forward, last year in the state of Maryland, we looked and we knew that this was coming. We could see what was going to happen, unfortunately, with the Dobbs decision. And we wanted to prepare. We wanted to prepare our providers to meet the need that existed in the state of Maryland, while also addressing need that we're expecting to see increasing from out of state. And we were already seeing patients coming in from Texas last legislative session. We knew that 2 out of 3 counties in Maryland had no abortion provider. We knew that patients were facing these significant barriers to care that were financially based because we hadn't modernized our insurance policy, modernized our Medicaid policy, things like that. And we also knew that because we hadn't updated the law in 30 years, there was just this increasing, kind of giving into the idea that we're allowed to stigmatize abortion, right? If we have these special buckets just for abortion policy that isn't related to any other reproductive or healthcare policy, that's stigmatizing. We didn't want to participate in that. So we did introduce and successfully pass the first piece of legislation in 30 years to deal with abortion policy in Maryland. This session, I was really proud to be the lead sponsor. Senator Dolores Kelly from Baltimore was my partner over in the Senate. We barely got it out. It faced 11 amendments on the floor with some really concerning amendments. It was a brutal fight to get it out, even though the state of Maryland you might think of as an overwhelmingly pro-choice state, even though we had this 60% vote in the referendum 30 years ago. And if you were to poll on that in Maryland, it would be more than 70% now of Marylanders support the principles of Roe versus Wade. That being said, we barely got the bill out. The governor vetoed it. We had to come back and override the veto. And that veto override, we had in the House, we had some wiggle room. We had a couple of votes to spare. In the Senate, there were 0 votes to spare on that veto override. So it's tight, just like we heard before. It's pretty tight in Maryland for protecting these rights. But what we were able to do with this legislation was make sure that anyone with Maryland insurance regulated in the state of Maryland, has abortion coverage with no cost sharing and no deductible, the same way we have coverage for other preventative healthcare services. We already did that for contraception, for vasectomies, maybe 10 years ago in Maryland. We made Medicaid coverage for abortion care permanent, again, with no cost sharing and really importantly, no justification needed. Our abortion care policy before in Maryland, if you were saying, I need an abortion because I was raped, you had to staple a police report to that. Things like that are really stigmatizing. Now we're saying, if you're a patient who's covered by Medicaid, you deserve access to abortion care, same as someone who's private pay. You don't have to tell us why, which I think is incredibly important when we're talking about justice. Advanced practice clinicians in Maryland, so that's nurse practitioners, nurse midwives, physician assistants who are appropriately trained and qualified to provide abortion care, are legally allowed to do so now in Maryland, which is huge. That significantly increases not only our number of providers, but the diversity of our providers. And again, when we're talking about reducing stigma, it means that if you see a nurse practitioner or a nurse midwife for your reproductive health care regularly, if they're the one giving you your birth control, if they're the one who was doing your labor and delivery services or miscarriage management services already, they're legally allowed also to provide you abortion care. You don't have to see a different provider who's not the provider you know and trust. That's really important for healthcare outcomes. Again, the overall picture we're looking at is how can we treat abortion care in Maryland just like the healthcare that it is and take it out of this political arena. The fourth thing that we did, which you may have seen about in the news, was provide state funding for clinical training for abortion care providers. One of the challenges that we identified, obviously, number one, if we're opening up providing abortion care to these advanced practice clinicians, we want to make sure they have the opportunity for training. But even more than that, we were hearing from a lot of doctors who had never received access to abortion care training and wanted to be providing services. So we established a $3.5 million annual abortion care clinical training fund in Maryland. We realized that the avenues for training clinicians were not providing adequate training in abortion care, and we wanted to close that gap. As we look in the larger context, with about 26 states likely to ban or severely restrict abortion, 44% of OBGYN residents are being trained in those states. So almost 50% of our future OBGYNs are not going to have access to abortion clinical training unless states like Maryland step up and provide this. So it's not just state funding. We're working with our medical schools and our nursing programs in the state of Maryland so that they're providing the training as well. But that's a gap that's going to need to be closed. And so I'm really glad that we're doing that. That funding was held up by Governor Hogan. We in Maryland are allowed to budget for future years to add things to the budget, but prior to a change in law, very complicated. For this budget year, we had to sort of set the money aside, and we set it aside. It can't be spent on anything but abortion care clinical training, but Governor Hogan has chosen not to spend it. So we don't have that $3.5 million this year, but next year we'll have $7 million. So that is happening. And in terms of next steps, because I don't want to talk forever, I could talk all day about this. I think it's just really important to touch on that, elevating the codification that we did of Roe versus Wade 30 years ago, elevating that to constitutionally protected. It's just a higher level. It's harder to roll back. We did pass that legislation out of the Maryland House this year. Unfortunately, that did not get out of the Maryland Senate. but we have assurances from the Maryland Senate President that that is a top priority for our next legislative session. So my expectation is that we will be sending the question to the voters in terms of adding what we're calling reproductive liberty into the Maryland Constitution. So that would cover not just abortion access, but also contraception, also the right to bear a child, should that be your choice, the right to sterilization. There are a lot of things that we're beginning to see challenged, fertility treatments, IUDs, emergency contraception. The opponents of abortion access don't even believe ectopic pregnancy is a thing. They don't necessarily support exceptions for the life of a pregnant individual. There's some radical things that we're seeing happening across the nation. So we want to make sure to protect against all of that with this constitutional amendment. We're also looking at legislation to protect our clinicians. I spent a lot of time talking about the important role of clinicians in healthcare policy in Maryland. We need to make sure they feel protected. They are rightfully concerned. They are being attacked by a lot of these laws in other states. So we're going to pass legislation to protect clinicians, pass legislation to protect patients, and look at all of these questions that we're seeing arising around data and data tracking. So there's a lot more policy work to be done in the next couple of sessions in Maryland, but we are certainly committed to doing so. I will say, and I know this is not a partisan event, I have deep concerns about one of our gubernatorial candidates because of his track record about introducing a lot of anti-choice bills. We need an attorney general who's going to support abortion policy. We need a governor who's going to put people in charge of agencies that are going to support abortion policy. These things really matter, especially in Maryland, as we're providing care, not only for patients in Maryland, but now those from out of state as well. And with that, I guess I'll shut up, but I'm happy to answer any questions. And thank you again for including me in this conversation. Really appreciate it.
Well, it is my pleasure to follow my colleagues from Maryland and Virginia. My name is Brianne Nadeau. I'm a council member in the District of Columbia. Now, it goes without saying for those of us in the district, but I will say it for those who do their work elsewhere, that whenever there is a federal issue, it's very different for us in the District of Columbia because, of course, we are not a state. And everything we do has to be approved by Congress. And we are always under threat that our autonomy will be rolled back. And I will explain today all the work that we are doing to protect the rights of people all across the country when it comes to access to abortion. And I want people to keep in the back of their mind how much this small but mighty jurisdiction in the nation's capital is fighting for the people all across the country, while at the same time, we don't have our own autonomy. There is great irony there. So I'll begin with a really important statement, which is that abortion is safe, legal, and protected in the District of Columbia at every state of pregnancy right now. People younger than 18 do not need to notify or get permission from their parents to get an abortion here, and Dobbs did nothing to change that. There's no reason not to seek, receive, or support abortion in the district, and the DC Council is working to keep it that way. So we are starting from a position of strength. In 2019, we passed the Strengthening Reproductive Health Protections Amendment Act, which enshrined the right to abortion in district law. And our Human Rights Act now prevents the government from interfering with reproductive health decisions and from penalizing abortion. It also prohibits employment discrimination against abortion providers. So there's no restrictions, no trap laws, nothing in our code that punishes abortion or restricts access to abortion. And that makes sense because at least 2/3 of district residents support abortion in all or most circumstances. But we are not out of the woods. The district has long been a safe haven for people seeking abortions, and 69% of our patients are actually from out of state. So bans in other jurisdictions can have a massive spillover effect here. Providers have already seen increased demand after Dobbs, and we have to act to ensure that everyone who travels to the district for care can continue to both receive an abortion and be protected from sanctions after an abortion. Under federal law, though, and this gets to my earlier point, we are not permitted to spend our own local funds to provide abortions. And until we become a state, Congress will continue to review every single one of our laws. If Republicans gain control of all three branches of government, or if Democrats choose to bargain away our autonomy, we could even be subject to a future abortion ban. And without the ability to spend our own funds to support abortion, and with the prospect of a future Republican Congress, we have to act fast and be creative. Now, thankfully, several bills recently introduced by my colleagues and I give the district the tools it needs to continue to be a sanctuary for reproductive freedom. Just a few days after the leak of the draft opinion in Dobbs, I introduced the Human Rights Sanctuary Amendment Act of 2022, and my legislation prohibits the government from cooperating with investigations aimed at imposing civil or criminal liability for abortion, the use of contraception, and a wide array of other protected conduct. And so if someone was to be sued under another state's bounty law, they could sue right back to collect the money they lost in the first lawsuit. So my bill had a hearing on July 14th, and I'm working to ensure that it's marked up and passed and sent to Congress for approval before a new Congress is seated in January. Several of my colleagues have also stepped up to the plate to protect access to care. Councilmember Christina Henderson introduced a bill protecting people who manage their own abortions and the people who help and support them. And Councilmember Robert White introduced 3 critical bills that protect abortion providers' licensure and insurance, and that require insurers to cover abortion care without cost sharing. So I'll be advocating for the rest of this year to get these bills passed and in front of Congress as soon as possible. The ball is now in the court of our committees on health and business and economic development, and I trust my colleagues to act expeditiously to move this legislation forward. Now, after that, it's difficult to know what might happen. So much depends on whether congressional Democrats answer the call to protect reproductive freedom. It must be a priority on their part to immediately remove the rider preventing us from spending our funds on abortion. And thankfully, that rider was absent from the DC appropriations bill that was recently passed out of a House subcommittee, and the rider was just defeated in the House Rules Committee. Well, we need to keep it out because oftentimes it's added in the committee of the whole. And if we don't get that rider kept out of there, our most vulnerable residents are going to needlessly suffer. Going forward, we have a fierce champion on the Hill in Eleanor Holmes Norton, and a commitment to reproductive freedom in every branch and at every level of government here in the district. We have a history of being creative, and when we have to be, preserving when we must be, and taking care of each other when the federal government falls short. So I expect nothing less in the months and years to come. And that is where we stand in the District of Columbia.
Thank you so much. I think I'm up. My name is Allison Tombros Korman. I use she, her pronouns, and I am here on behalf of the DC Abortion Fund. I want to thank JCRC for having this conversation and for inviting me and these colleagues to be a part of it. And just to say, I'm so proud that we're having this conversation, and we have been having it for the last week, many weeks and months and years through a Jewish lens. I think it's really important, as the comments were said earlier, to recognize that there is not one way to understand abortion through a religious lens, and as a Jewish woman, my religious freedoms are infringed upon when we limit abortion. So I just want to thank everyone for being part of this conversation. I don't know about you folks, but I know that certainly in the wake of the SCOTUS leak and the Dobbs decision and post-Dobbs, there was a ton of conversation in the news about abortion funds. And even my own sister came to me and said, like, I know you work at an abortion fund, but I don't entirely understand what that means. So for those who may have similar questions, I want to just kind of paint a little bit of a picture. Abortion funds are grassroots networks all over the country that exist to help people who are struggling to access abortion care. And primarily we do that by covering financial gaps that may exist between the cost of a procedure, what a patient can afford, and the total cost. So we're there to fill in that gap. The DC Abortion Fund is one of the largest abortion funds in the country, and it serves DC, Maryland, and Virginia. Obviously, DC residents are a large portion of our callers that we serve, but we do serve folks coming from DC, coming from Virginia, from Maryland, from Virginia. And as was talked about earlier, now we're seeing even more so folks coming in from outside areas. And I'll talk a little bit about that in more depth. Just to give you kind of a sense of our scope, we get about 6,000 calls a year, and we currently grant about $100,000 a month in abortion services. And that's more than double what we were spending about 18 months ago. And part of my job is to track and see how that number is changing, both the number of calls and the amount of money that we're pledging as we kind of navigate this post-Dobbs landscape. So because we have a couple of the later term providers in the DC area, we know that people come to the DMV for these prohibitively expensive procedures, and we anticipate that need continuing to grow as we navigate a post-Dobbs world. I also want to kind of paint a picture of some of the other folks that we work with, particularly practical support networks. Those are also predominantly grassroots organizations who help fill in some of the other needs that folks coming here to seek abortion care might need. Those would be things like, you know, paying for childcare, paying for travel funds, paying for meals in a very expensive city when you come to DC to seek abortion care, you know, post-abortion care expenses. So practical support networks, sometimes those happen within an abortion fund, sometimes they're independent organizations, but they're there to help kind of create those wraparound services that are so essential. I think it was spoken about earlier, but I just want to reiterate that even when Roe was intact, abortions were out of reach for so many folks for financial, logistical, and social barrier reasons. And that is why organizations like DCAF exist, is to help folks navigate those barriers, and we continue to do that. What we're seeing right now in a post-Dobbs landscape is honestly heartbreaking. I don't really have a better word for it than that. I wouldn't say that this work wasn't heartbreaking before Dobbs, but it's kind of taken on a whole nother level of meaning. We are working with patients and other abortion funds and practical support networks and attorneys and healthcare providers, all struggling to figure out how do we continue to operate now, given the legal landscape. We are struggling on a day by day and even hour to hour reality of trying to make sure that we can get people legal abortion care in places that it is legal, but that ground is constantly shifting under our feet. And I truly mean that. What was legal on a Thursday afternoon to get a person care might be illegal on a Friday morning, depending on, you know, a court that's made it, you know, a lawsuit that's been gosh, I'm not an attorney and the words aren't coming to me today. So, but a lawsuit that's been challenged, or a court decision. And so we're really struggling in real time to figure out where can we get this patient to a place where abortion is legal so they can get the care that they need. I'm sure that a lot of you have been hearing about the cases of providers who are really struggling. Caitlin Bernard is a provider in Indianapolis who provided abortion care to a 10-year-old girl, which I don't even need to explain why that is so incredibly troubling that a 10-year-old girl needed abortion care. But this provider has been struggling with, lawsuits, challenges to their license, shaming, and calling this person out for things that they were doing that were providing legal healthcare in the state that they provided it. I think all of you are probably aware of the conversations that are also happening around the concerns with ectopic pregnancies and the fear that some providers have that if they terminate an ectopic pregnancy, which can be extremely dangerous, life-threatening to the pregnant person, that they may find themselves in violation of an abortion law. And so they're kind of throwing up their hands going, I don't know, can I help this pregnant person who is in a life-threatening position? So the realities on the ground are really quite scary, and the stakes are incredibly high. All of that feels not great to say out loud because it doesn't inspire a ton of hope. So one of the questions we get all the time is, what can we be doing? The number one thing that folks can be doing right now is donating to their local abortion fund. We saw a ton of rage donations after the Dobbs decision, and that's great. That is fantastic that people wanted to channel their frustrations and their anger into supporting abortion access. But really the best thing an individual can do is to make a recurring donation to their local abortion fund. That helps us plan in a long-term way that a one-time wage donation just can't do. We would love for folks to host fundraisers so that they can involve their own networks in spreading the word about abortion funds and raising money and continuing to bring more recurring donors into the network. And most importantly, we would love for folks to just spread the word about abortion funds and practical support organizations and what they do. So many folks don't know about abortion funds, or maybe they have to hear about it from their provider. And we know that time is of the essence here. And so the more folks that know about abortion funds and how we are here to support patients, the more effectively and efficiently we can support those folks. So as the other panelists said, we're so grateful for your interest in this topic and happy to answer any questions that you have.
Thank you so much. I'm going to now take a minute and bring all of our panelists back. Oh, and I'm going to ask you, Allie, yeah, there you go. All right, and now I just have to add me so I can talk with all of you. There we go. All right, thank you all so much. It was really great to hear sort of the lay of the land, and I'm going to try to kind of summarize before I get into the questions. And please jump in and interrupt me if I get it wrong. But this is sort of, I think what I heard is that in Virginia, abortion right now is legal, but it's not guaranteed to stay that way. And we expect every effort to change that in the upcoming session and the upcoming couple of years at least. And really the most important thing is that people vote on this issue when they go to the polls on election day. In Maryland, abortion is legal, but access has been outdated. In the last session, you've made efforts to change that and to bring it up to date, but there's still work to do. And that your overall goal has been to make abortion care just part and parcel of good health care. And in DC, it sounds like abortion is safe, legal, and accessible, and really subject only to the whims of Congress, based on the overall DC statehood issue. To kind of get, did I summarize all that? Right. Great. And in terms of the abortion fund, the thing that you need most is donations. The need for your services has more than doubled in recent, and you only expect it to go up. So let me start with you, Ellie, on that point, because one of the questions that came in was really on that topic. Is there a way for synagogues to get involved? And can you talk a little bit about what that would look like?
Yeah, that's a great question. We are seeing synagogues really activate around this. We've heard from folks at Addis Israel. I think that makes a lot of sense. It's a huge congregation and with really committed to these issues. I know that I'm working to do things in my shul as well. So kind of engaging folks in synagogues around those opportunities that I mentioned are important. But I don't just want to kind of hit home on the fundraising piece. I mean, to the other panelists here, Delegate Filler-Corn and Delegate Kelly, I'm sure they would welcome synagogues turning out to support the legislation that they are working so hard to pass. I'm sure that there's a lot of state advocacy that we can be involved in as a religious denomination, saying that we are so proudly in support of these issues. And that really gets to kind of another larger issue, which is just taking away some of the shame and stigma on this and being unafraid and unapologetic to say, I am pro-abortion. My clergy are pro-abortion. These are the reasons why Judaically abortion is, not just permissible, but often required to save the life of the pregnant person. All of these are ways that we can kind of tap into our Jewish networks and roots to be advocates.
Great. And Delegate Filler-Corn, I see your hand is raised. Just jump on in.
Okay, thanks so much. Appreciate that, Vicki. And definitely, I couldn't agree with Allie more. And I really do, as I said earlier, think that nothing's more important than making sure we do have the opportunity to speak out on these issues. And that's why JCRC's organizing us and bringing this, public discourse is so important. I think, as Ali said, public testimony, obviously, in the legislature, certainly in Virginia, would be tremendously helpful. We have a tremendous group of partners, organizations, stakeholders that are just out there, supporting, very supportive of our positions and certain bills. But we know that there's an effort already, as we have seen from our governor and others, to draft and craft legislation doing the exact opposite and going the opposite direction, not just of what our views are and our beliefs and religious and otherwise, but also against the majority of Virginians. And so it is important that we have this conversation. It is important that we talk to our neighbors and everybody that we can about the importance of where we are at this critical time and why this issue matters.
And I would add too, I agree with everything that Delegate Filler-Corn just said, and just some of the other things she was mentioning about sort of the religious liberty side of this. I really feel as though what we're seeing happening is this, the entire concept of the United States as a country that supports religious pluralism just being thrown out the window. And to the extent that the Jewish community can raise their voices and say, we are not okay with that. Like that fundamental principle is not going to work in my country, because that's really how we're seeing it play out in healthcare policy, right? There is this issue. There is the issue of whether hospitals provide, will give a person an IUD after giving birth, or sterilization if they'll tie your tubes after you give birth. This is going to get worse and worse. And for folks who are not of this extreme belief that fetal personhood is where it's at and it's God's will for women to suffer in labor even if they die, if that's not your belief, then we have to start standing up and say we're allowed to have different beliefs, and it can't be the law of the land that's how we are. And it doesn't necessarily play out neatly across party lines. In the state of Maryland, we have Democratic supermajorities in both chambers. I have pro-choice friends who are Republicans who could not vote for this legislation that we passed. And I have a lot of colleagues who are Democrats who would not vote for it because they were morally opposed to abortion under any circumstances. And that's the reality. So we have to be willing to have those uncomfortable conversations. And to me, it always comes back to, I absolutely profoundly respect your right to your religious beliefs, but in our democracy, we have to respect each other's rights to have different religious beliefs. And what we're seeing is really undermining that basic principle.
And in Virginia, I mentioned our governor, begins every single meeting and board and commission meeting with prayer of his faith. And I think all of us, understand, what that means. I mean, we know that he's a person of faith. We know that his religion is important to him. It's even more important, therefore, and you would think there was even more impetus for him to understand why you need to be tolerant of other religions and those Jewish Virginians, not to mention other faiths. And, I just think bringing up and this is why I did that, organize that Zoom on religious freedom, talking about that we're focused on Jewish law and how the governor's commitment to introduce this legislation, as well as other members of the legislature that are committed to, taking away our liberty, it's in direct conflict with our religion, but it also puts the priority at the Jewish law, Jewish faith, puts a priority on the life of the mother. And that seemed to be a new concept, I felt, at least with some of the reporters on that Zoom. And I think that goes back to, what Ali said too, that is why these conversations are so important. I'm the only Jewish woman legislator in Virginia. And, we need to be standing up. We need to be educating. We need to be informing. We need to have these conversations.
And I think especially in that little niche that Eileen just mentioned, what Ali was talking about the DMV being a place where people come for abortion care later in pregnancy is extremely relevant, because in these very complicated situations that Jewish law talks about, right, there are very few places in the country that people can receive care, and DC and Maryland are two of those places. I don't know, Ali, if you have something to add on that. I appreciate it.
I would like to add to just, thinking about what we're doing here in the District of Columbia and just how fragile it is that as congregations are thinking about what they can do, helping protect what we have is really important. You know, we have congregations all around the region and congregants who have more voting rights than their neighbors in the District of Columbia. And so when we are working on these issues as a region, part of the conversation has to be advocating to voting members of Congress and the Senate to protect the rights in the District of Columbia. Since we don't have those votes in the Senate and the House, we depend on our neighbors. But the other thing is thinking about it like, you know, we all have friends and family in other parts of the country. I'm sure many of us have friends and family in states where we now have abortion bans. And when you look at the District of Columbia, not only, of course, being a place that people have been able to come all this time, 69% of the people receiving abortions in the district are from other states, but also with our new sanctuary law, we're not only protecting the right to an abortion, we're protecting the right to access to contraception, we're protecting the right to marry whoever you want, the right to gender affirming care, and also the right to a private action if somebody comes after you with a bounty style lawsuit. And so what we need from congregants around the DMV and congregations around the DMV is help protecting the district as Congress changes, which we fully expect it will, and making sure that we can continue to offer these services to people all across the country.
Actually,
Really?
before I jump on, Brianne, you just hit on one of the next questions I was going to get to. But before I get to that, I do want to point out that JCRC did a webinar a number of weeks ago on Jewish law and reproductive health and abortion. So if anyone did not see that and is interested in a conversation between a Reform rabbi, a conservative rabbi, and an Orthodox Maharat, about the differences in Jewish law in the different denominations, that is available. And if you have trouble finding it, just shoot me an email and I'll be happy to provide it to you. Before I go to the next question, Allie, did you have something to add to this point?
No, I just want to say thank you to Delegate Kelly for bringing that up. I mean, that is a really scary reality for us, that right now we're working within this window that is closing every day, right? And is getting tighter and tighter. But we get this question all the time. What happens if a Republican controlled, federal government outlaws abortion full stop in the district? And the truth is, like, it's a terrifying prospect. It's terrifying for the patients. It means that supports like abortion funds and practical support networks, we cannot be there, or, well, we don't know what it will mean, but I presume it will mean we cannot be there to support folks who are coming to these last couple of safe havens to get the care that they need.
And that, just clarifying, because Councilmember Nadeau, when you were talking, you referenced the funding that the federal government controls. Is it a concern that with a Republican or a Republican controlled Congress, that they could override all of these laws that you said exist right now to make abortion available in the district?
Yes and no. I mean, first and foremost, it's a lot of work for them to override all of our laws. I mean, there's a member of Congress right now threatening to repeal home rule, which is the autonomy that we do have, meaning like Congress would run our government again. And frankly, like, I hope it's an empty promise, but I also think once you drill down on what it takes to run a local government, it might not be so attractive to the members of Congress. Once we start showing up with our trash on their lawns because it's not being collected, right? We've seen it in the past. But I will say there's a few things. One, so congressional review still happens with every law that we pass. So they have a 90-day period where they can act on our bills if they want to. So that's the most concerning thing right now, is passing our bills this year. The congressional review period will creep into the next Congress. I'm hoping the first 100 days they're too busy doing other things, but it's very easy for someone to just tack on a DC repeal bill to anything that's moving. And, not supporting statehood in a full-throated way and getting it actually done is sort of a bipartisan thing, right? Like, we haven't gotten it done. We've gotten further than ever. House has passed it now, but it's always stuck in the Senate. So, like, a lot of things that we wish we could have done at the federal level when Democrats had control of both houses, we haven't gotten statehood done. So there's a concern about that. The funding thing is real right now. And we've been dealing with that for a long time. So a prohibition on spending our local dollars. Remember, we have budget autonomy. All of the dollars that we spend are ours. We get the same federal allotment that every state does based on the federal programs and block grants. So we're not, it's not the olden days where our budget was just a stipend from the feds. So they say we can't use our local dollars on abortion, which means that the abortion fund has to do all this fundraising themselves, right? And given what we are taking on for the nation right now, that's a lot. So being able to spend local funds on that would be huge. I'm not saying that taking on the burden for the entire country with our DC local dollars is the direction we want to go, but having the option, at least for our own residents, right, would be a really big deal, or some reciprocity agreement with other states would be a big deal. But think about the past. Congress has banned needle exchange programs. It's banned all kinds of public health measures just because they seem like progressive issues when we know most of them are about healthcare. So, there are threats every day. What shape they take, I think is, it's too soon to tell. I think the most likely threat would be some sort of congressional interference during the review period, as opposed to going through our laws and repealing them, which takes more effort and has to get through a subcommittee and then a committee and then, so, we are hopeful. I'm not going to say we're optimistic. And I think we're in a very precarious situation.
I do have one of the comments in the Q&A is to caution us not to assume anything about the midterm elections. And that we should remain optimistic and hopeful and do our part in voting the way that we need to ensure the outcomes that we want. So I'll just throw that out there. With that in mind, I'm going to turn to you, Delegate Filler-Corn. There is a question about the constitutional amendment, and that it wasn't something that was on the table, I think is what you said in the before. That's not one of the constitutional amendments that was that you tried to get through last term, if I remember correctly. Is that something that if the Democrats retake the House that you see as a possibility? How do you see, what would be the path for that? And is that something that you would like to get done?
Absolutely. I think we saw, obviously, that they have the ability to just, treat it as a bill and, and reverse it as we did, as I mentioned, with same-sex marriage. But yes, to codify Roe v. Wade in the Virginia Constitution, as I mentioned, it requires a two-step process in the legislature. And I think Delegate Kelly said the same thing. So first, the amendment to the Constitution would require passing, the House, then it would have to pass the Senate, and then it would have to be placed for, proposed change on the ballot for the Virginia voters, and would have to be done twice. So, absolutely. And as I mentioned, we did have the opportunity to try to waive the rules to introduce a bill during the last special session, which again, they just, rejected and could happen again. So that's really the only way, that we could move forward. And
it sounds like you don't, in terms of the actual path that you just spelled out the path of what has to happen. Yes. It doesn't sound like you think that there's that there's an appetite for that, if that's the right way to say it.
I mean, definitely. I mean, it just, yes, absolutely. We want to do that.
But do you see any give within the conversations, whether it's across the aisle or otherwise, that would give realistic opportunities?
And again, it comes back to electing like-minded people, so that we have the votes and we have the individuals who are going to support that. I mean, what we knew and what remains, the process is, it has to be twice during two separately elected general assemblies. So you need the votes, you need the support. We had it in the House, we don't have it now. We need three more seats to regain the majority in the House. And we need, obviously, with 21-19 in the Senate, And as we mentioned, or I don't think I mentioned it, but 2020 doesn't do it in the Senate because then it goes to before the Republican lieutenant governor who will vote against us. So,
Right.
And I think too, just to add on to what Delegate Filler-Corn is saying, because the way politics play out in Virginia is very different from how we see it play out in Maryland. So we could have numbers, for example, in the Democratic Party, but it doesn't mean we have the political will to do what needs to be done. It really comes down to, I think this is what Ali said, if this is an issue that you care about, you have to talk to the candidates about it. You have to make sure they understand it's a priority, because what we saw behind the scenes, in my caucus in Maryland was enough people saying, I'm not sure this should be our priority. I'm not sure this is where we want to vote. I think we need either more moderate legislation or no legislation, or next year or no year or never, right? Behind the scenes. They might not put that in their campaign literature, but that can still be their personal feelings, and they can really gum up the works. So they need to hear from their constituents that this matters.
Absolutely. I totally agree with Delegate Kelly. And remember too, it's like people naively or whatnot didn't believe this was coming. We can talk about how this has been chipped away for 50 years, but regardless, people didn't believe it was actually in jeopardy. They didn't believe we'd be where we were today. Now, again, we know exactly where we are. We see it. We've got to get, back to what Ali said, we've got to get everybody talking about it. And as Delegate Kelly said as well, if the elected officials hear that this is a priority, they hopefully will act accordingly and move and focus on it.
And so when we backtracking just a little bit, when we're talking about the religious liberty aspect of it, that's not necessarily something that you're seeing traction amongst your colleagues who talk about religious liberty in other contexts, whether it's the governor who's doing prayers or whatnot. But that's something that you're sort of telling us that we need to think about and talk about. And so when we reach out to our legislators and let them know that it's important, that's another way that we can talk to them about it that maybe they haven't really been thinking about before.
Definitely. And building coalitions with other faiths, right? It's not just us in the Jewish religion, and I know that you guys have been fabulous about that. We all know, and we all have elected members of our bodies that of other faiths that agree with us. Again, it's just not something, I don't know why, that really has been discussed much. And I know the mainstream press really didn't fully understand. And, I felt like I got a lot of questions and a lot of, interest after that Zoom. We had another opportunity. I joined another Zoom with Rabbi Schwartzman and Temple Road of Shalom. They also had somebody on from the National Council of Jewish Women and CJW, and they're very, very public about, educating and informing everybody as well. And I just feel like this is an aspect of the issue, I guess, abortion rights, reproductive health care, right to choose, whatever, that really hadn't been explored or certainly not vocalized, communicated as much until now. And I think that, it behooves all of us to do exactly that and bring other faiths into the conversation with us.
Someone just posed a question that I feel like I've heard echoes of in other conversations, to the extent that there's rhetoric out there about women using abortion frivolously. How do you address that? I guess is in terms of speaking with other lawmakers. Is it just stressing the medical necessity? Is it so offensive that there's no way to address it? What are your thoughts on that?
I always start with the best way to reduce abortion is to reduce unintended pregnancies. That's the number one way and the best way to do it. And you just pivot, because the reality is, we just did paid family medical leave in Maryland. There's no overlap between those states that are banning abortion and those states that have paid maternity leave. In fact, Maryland Right to Life, when they came in opposition to my bill, I asked them about whether they were supporting the paid maternity leave bill, and they said, we support a free market approach to maternity leave, right? It's not about children. It's about controlling women's bodies for religious reasons. And that's sort of what's getting at the root of that question, right? There are these evil patients out there who use abortion as birth control or whatever. Just pivot and say, okay, what can we do to prevent unintended pregnancies? Let's join forces and work together to prevent unintended pregnancies and make it easier to raise kids in this society, right? Instead of putting blame on women, because their game is shame, stigma, and blame.
Anyone have anything to add to that? Or that was succinct enough. So as long as you were talking, Delegate Kelly, I will give you a question that came specifically to you, which is, could you go into a little more detail about what kind of data legislation you are expecting?
Well, so this is August. We are working with all of the different states that are friendly to abortion access. We're working sort of in coalition, figuring out what the best approach is. So we don't have draft legislation yet. We don't want to have draft legislation yet, right? We want to see this unfold a little bit. But the problems we've identified are, potentially, people potentially using your cell phone data, people potentially, and when I say people, actors from other states, right? And it's really important to note that whether they can successfully do this or not, whether it is constitutional or not, the fear that it creates plays into that shame and stigma. It's a terrorist type activity meant to reduce people seeking care and shame people and scare people out of providing care. So we need to have really tight laws on the books, even if they're not necessary, to make sure our providers feel as protected as possible. So, your cell phone data, your health information exchange data, the data related to your pharmaceutical access, there's all sorts of databases that share this information right now. And in Maryland, we've worked really hard over the last couple of decades to modernize our health information infrastructure. And now there's the potential that this could be used against patients seeking care. So we just need to make sure that everything is really, really tight. That being said, the details of getting that bill right is going to be really complicated. So we have a number of legislators from in Maryland and all the stakeholders around the table figuring it out and working with the other states who are also trying to do exactly the same thing.
What's the federal overlap with that kind of legislation? Is that, yeah.
I mean, there's a huge federal overlap, right? With everything we're talking about. And
right.
The complicated thing, and those of us who've been working in this policy space for decades know sort of the way we've dealt with international reproductive health care for decades, where it becomes like a ping pong ball with each administration. We have the global gag rule, we don't have the global gag rule. This is what American women are up against now. I trust the federal government and certainly many of the agencies right now under this control. And, in a couple of years, that might not be the case. So anything that we can look to the FDA assuring, anything we can look at HHS assuring, or the Department of Justice assuring can go away just as quickly. And that is what is so terrifying.
Yeah.
So we want redundancy in our state law with any federal protection that exists as a minimum.
Yeah. To any or all of you, I think one thing we've all heard about on the news is this idea that some states are going to try to make it illegal for people to cross state lines. Can you just comment a little bit about that? Like, how real of a threat is that? How are you dealing with it? And Allie, maybe we should start with you, because I think you deal very directly with that, and then move on to the legislators.
Yeah, it's extremely real. It is frighteningly real. DCAF is continuing to do everything we can to fund legal abortions where abortion is legal. That is, what we have in our locus of control. And so we are trying to focus on getting folks here to DC, and obviously Maryland and Virginia as well. I say DC because there's things happening behind the scenes where we're trying to let the Maryland funds work more with the Maryland patients, and the Virginia funds work with the Virginia patients, but that's not important. The important part is getting folks to the DMV so that they can get legal abortions in states where abortion is legal. I don't know that there's much we can be doing right now beyond that, aside from all of the aside from all of the legislative angles. And we're really grateful to Councilmember Nadeau for introducing the legislation that she and her colleagues did in DC to do everything it could to protect some of these access points, to protect people who are doing self-managed abortion and those who are giving them access to those medications or driving them to pick up their medication. But it is a really kind of like Wild West situation in not a good way. And for every attorney we speak to, we get a different opinion on how this is all going to play out and what extraterritorial reach is going to look like, what cases are going to be tested, who are they going to come after to test these cases, and we just don't know.
Do the others of you have anything to add in terms of what's going on legislatively in your jurisdictions related to this? No.
I think, yeah, we just don't know yet. That's the scariest part, right? So legislatively, Maryland, I can assure you, is working to pass everything that we can. Every idea that we have seen that is potentially working in other states, any possible deterrent. So much, we have a number of our local jurisdictions who have already announced that they're not going to cooperate with any out-of-state prosecutions and things like that. It's not all of our local jurisdictions, though. You'll see the obvious divide you might predict. So we're looking at legislation, but at the end of the day, I think it comes back to this: if things are going to be tested by court cases, then people are going to get sued, right? And we know where we're at. We know where we're at with the court system right now. Nobody in this space trusts it.
Okay. Well, I want to express what I keep seeing in the Q&A, which is our thanks from me personally, from the JCRC, from the many people who've put it into the chat and who are here listening. Thank you to all of you for what you're doing, and trying to end on a positive note. I'm going to ask another question that has come in. We've talked about donations, and we've talked about getting out to vote. Can you talk a little bit about what other ways, if there are any, that people can help, whether it's maybe retired nurses, or just individuals? Are there volunteer opportunities to help in these efforts? And again, why don't I start with you, Ali? I feel like that's the most direct to you, and then see what others have to add.
Sure. I know it's frustrating sometimes when it feels like the answer is like, give more money. And that's not always the right answer for everyone. I totally respect that and appreciate that. So I do want to offer some alternatives. Abortion funds are often looking for case managers. I direct messaged a couple people privately to let them know if that's something that they're interested in. They can go ahead and reach out to me, and I'll connect them with the right people at DCAF. It's a commitment. It's a real commitment, and I don't want to understate that, but it's also incredibly important frontline work that people can be doing. I think, as we heard referenced earlier, getting involved with your local or your religious affiliation and engaging with those folks to be part of advocacy efforts. And me personally, I know that I have been really moved to see my clergy become involved in these issues. National Council of Jewish Women has a campaign. I think it's called Rabbis for Repro, or Repro Rabbis, something like that. You can absolutely find it on their website. And just kind of seeing that list of clergy who affirm the right and the need for abortion access and other types of care, I think is a part of this, conveying to your representatives how important and multifaceted this work is. And I'll just stop there.
Rather than asking the other three of you to add on to that, feel free to do so. But I'm going to also ask you, as we're getting close to time, to just take a few moments to, provide whatever final thoughts you have to leave us with. And I'm going to go in reverse order. Although, Ali, since you were just speaking, I'm actually going to go in reverse order of jurisdictions and ask you, Councilmember Nadeau, to start.
Sure. I mean, I think the key here is sticking together and working together and making sure that we're all in the region fighting to preserve these rights. You know, we've got different challenges in each of the 3 jurisdictions that are represented today. And I think it's helpful for each of us living in one of them to hear what's going on in the others. Because, you know, there are things that we can each do to help in every area. So I will today pledge my support of my colleagues in Maryland and Virginia for their efforts. And we'll be here anytime you need me, call on me, we'll show up and lend our assistance. And, you know, hope that we can make that a universal thing. But I think, you know, hope is not lost. There are good people working all around the country to protect women's rights and women's access to healthcare, and all of the fundamental rights that we have worked to enshrine over the years to keep women and people who give birth safe. So we'll keep fighting that fight. When I introduced the sanctuary bill, I talked about how, gosh, almost 20 years ago, I marched the March for Women's Lives. And I'm sure there are other women on this call and men who have marched many, many, many more years longer than I have. And we despaired back then when things weren't even quite as bad. And we got through it, and we'll get through this too, but only by sticking together and not letting the people on the other side tear us apart or pit ourselves against each other. So keep that in mind, have hope, and we'll keep at it.
Thank you. Delegate Kelly.
Wow. Well, thank you to the council member. I appreciated her words as well. And I think it's so nice that we're here together in a region with, you know, similarly minded people who share the same commitment. So thank you. Thank you so much. When I think about the situation we are in, I was on a call last week with Brookings, and there was a brilliant economist talking about this, and she gave this quote that just, it floored me. I knew it, but it floored me. It was sort of in this post-Roe, post-Dobbs world, what we're going to see is multiple generations that become, this is an economist speaking, a permanent underclass. That's where we're at, because reproductive healthcare, right? I grew up poor, right? My parents were teenage parents. I was the 3rd child in their family. I grew up poor. It was hard. And now I am upper middle class and I represent Bethesda, and I don't complain ever about my life because I know what it's like to be a poor kid in America. And it sucks, right? And what we're doing is creating so many more poor families. And so I think as we think about sort of our Jewish values and how we can carry forward with advocacy around reproductive justice, it's important to make that connection between reproductive justice and religious liberty and economic justice, right? 75% of the women seeking care are low income individuals, not all women, low income people though. These are families that most of them already have children in them. We are perpetuating poverty through this national policy, which is just basically a bunch of extremists with their limited, narrow religious view have hijacked our court. And this is the situation we're in, right? So I think it's really important that we not lose that moral context. I think, and I've heard a lot of other folks say the same thing, that it's so much worse today than it was before Roe. People talk about how we're rolling back the clock and it's like it was before Roe, but before Roe, there were not these vigilantes coming out attacking patients seeking care, right? It was not this kind of aggressive hostility. This is all of the bad things we've been seeing in American politics manifested on the bodies of people who can give birth. And so we have to just really stand strong and fight and not be afraid to talk about it, right? That the shame and the stigma that I've been talking about this whole hour, like we have to shed it as people who are advocating. We have to never be ashamed to use the word abortion, never be ashamed to say people need this care, right? And I think that I would appreciate as we move forward that we all just realize that I think we're on the very moral side of this fight, right? And in my relationship with my God, I know we are doing the right thing here. So.
Thank you. Delegate Filler-Corn.
Thank you, Vicki and JCRC. And I agree with everything that has been said already. I really appreciate your taking the initiative and bringing us all together. And, as I said from the beginning, and as I think we all have shared, abortion is legal in Virginia, but the final line of defense is standing between Virginia women and our current governor is a slim Democratic majority in the state Senate. And I have to say it because that's factual. And the only way that we can ensure that our basic liberties remain intact in the Commonwealth of Virginia is to elect strong pro-choice candidates. Again, in the federal and the state, elections, but we have to expand our majority in the Senate. We have to flip the House. And the way to do that really is through contact with your elected officials, getting involved. We talked about all the different ways that you can volunteer, also campaign work, and making sure that when you're speaking with your neighbors and anybody in your area and jurisdictions, they know just what's at stake and what is the defense standing between women's right to choose, standing abortion right, whatever we're calling it. And we all know too, so much of that is messaging. So whatever terminology helps, let's not shy away, as I think Delegate Kelly said, from saying abortion care, but whatever, if it's religious freedom, there's so many reasons, of different reasons for supporting what we have been supporting for so long. And you can call it different things and you can message it different ways and whatever works. But the bottom line, we have to be talking about it and we have to communicate that. We can't be shy or, this is the time for us to use our voices and to, communicate. And so just elevating this issue, the issue of bodily autonomy, the issue of, religious liberty, whatever, and all of the above. There's so much at stake here. We know that these are unprecedented times. And, as I said earlier as well, these are attacks that we have been withstanding, but more so now from a vocal, powerful minority. And we just have to stand up for it. And I know I also really appreciate Councilmember Nadeau. We stand together. We're going to work together. And we are unified in this region. And thank you again to JCRC for bringing us together today.
Thank you. Allie, how about if you wrap us up?
I don't know. That's hard to follow. Those are such amazing closing remarks that I agree with wholeheartedly. The only small, consideration I would add is, people keep reaching out to me going, oh my gosh, this must be so hard right now. Your job must be so hard. I'm like, well, it's definitely hard for everyone. And yes, and the only thing truly that is getting me through is seeing community come out for each other. And I think that's really what each of the folks who just spoke before me was getting at, is that it is about supporting your community, showing up for your community, engaging your community, rallying your community, and doing everything you can. That is the silver lining that I am grasping onto with all of my might. So I hope that folks find ways to embody that in their own lives.
Thank you so much. It has been such an honor to be here with the four of you today. Thank you for joining us, and thanks for everybody who came out and listened, asked questions and participated. And I know I'm going to be spending time with all of you doing this work for quite a while. So thank you all, and I look forward to seeing everybody at our next webinar, at our next event. And thanks. Have a good day.